we've been talking a lot about what's happening in the United States, but let's put this in a global context of where we are with the concentration of wealth and power. Thank you, Paul.
Thanks, Erica. Yes, time to go global. Take a look at the screen. See that little green part on the left? That's the Royal Nairobi Golf Club. That is where the Buena Kubwa come to spend their weekends. That's the big men in Nairobi, the ministers, the billionaires, and they have their nice little time together. On that hole, when they go long, when they hit it over the green, they're going to hit somebody. You know why? Because that part on the right side is called Kibera, and it is the most densely populated place in the world. 1 million people living in about a square mile of land. Oxfam, I used to work there, and I'm going to tell you a little bit about my experience when I went back recently. Oxfam in 2013 asked how concentrated is extreme wealth. We found that 85 people had the richest 85 had the same wealth as the poorest half of humanity. We asked again in 2015, and that number had gone down to 62. Last year we asked it again, and now it's 26. How's this happening? Here's how it's happening. We're seeing a new billionaire every 2 days. 10 years ago, there was less than 800. Today, there's more than 2,200, and collectively, they own $9 trillion of the global economy. What's happening for the other half of humanity? Last year, we found they lost 11% of their wealth. You're talking about people who are living on $5.50 a day. They're losing money. How is this happening? It's happening because of taxes, we think, at every level. If you look globally, and these aren't US numbers, these are global numbers. Top income tax rates in 1970, 62%. Today, they're 38%. Corporate taxes. That tax break that just went out, we released a report yesterday that found just 2 clauses from the recent tax breaks gave 4 drug companies $7 billion. That's enough money to pay the health insurance needs of 2.2 million kids. Wealth taxes, same trend. That's the line at the bottom. So where's all the money going? Well, we found that 7.6 trillion of it is sitting in tax havens, doing nothing for anybody. That's where the wealth is going. Are we taxing that wealth? No. Globally, we're only getting 4% of tax revenue from wealth. Think about that, 4% from all this wealth. If we just added 0.5% and taxed the top 1%, 0.5% more of their wealth, every single kid around the world who can't go to school today because their public services don't have the money, that's 262 million kids, they could go to school. And at the same time, as well as that, you could get basic health care to 3.3 million people, literally saving their lives. That is the relationship between these two facts. The IMF found the same thing. The IMF said, if you want to reduce inequality, there's nothing better you can do than spend it on healthcare and education. In the 13 countries they looked at, it accounted for nearly 70% of the reduction in inequality. When we went out there and looked at it, we work in about 100 countries. We went to the countries that are doing the most to reduce inequality. And we looked at, for example, those countries that are helping mothers get through that period of childbirth. The countries that are doing the best on that front, 90% of their money comes from public services. So this love affair we have with private sector is going to solve all our problems, it's actually a tiny fraction of the solution for people really on the wrong end of inequality. In the end of the day, and we've been hearing about it all morning, we're really having a conversation about 2 different economies. What we've been sold for the last 4 decades is the neoliberal model. If you want public services, get it through insurance. Let's just create the financial incentives. What are we talking about? We're talking about rebuilding a human economy. One that is tax financed, one that is values driven, one where services are genuinely public and universal. Everybody has a right to them because they're citizens. This isn't just about how many toys these folks can buy. This is a story about power. Jeff Bezos, 1% of his wealth is the same as the entire health budget of Ethiopia. That's 114 million people, 1% of his wealth. That's not just money, that's power. When these guys, these 8 guys, we documented this story and the Times covered it. When these guys sit around a dinner table, they don't just get to talk about what's their third boat going to look like. They can change the fate of nations. They can decide what we think, what we see, who we talk to, how we live. That is what is happening to our democracy. They are the Bwana Kubwa, the big men of today. So when I went back there a few weeks ago to the place that I was in, I was asking myself, what's the relationship between these two places? And I met Beatrice. Beatrice, see her t-shirt, NTA, that's National Taxpayers Association. And I said, hey, Beatrice, I used to work here, and they didn't have big buildings like that one behind us here. They just used to have sheds. How'd you get the big building? And she said, that's a health clinic. Let me tell you how I got it. We went and looked at our taxes that were supposed to be coming to our slum, and we were supposed to get a health clinic. So I went to the Bwana Kubwa, and I said, where's our health clinic? That night, he sent henchmen round to our house and said, you can talk about a lot of things here, but don't talk about taxes, and don't talk about your tax money, and certainly don't talk about why I'm not spending it. So she went home, and she talked to her tax friends, and she said, let's go and see whether people want their tax money sitting in the Bwana Kubwa's pocket or in our health clinic. And they went out, and they got people to sign petitions, and they went back, and they sent them a whole bunch of signatures from all the mothers in that slum and said, we want our tax money. And a week later, they started to build a building. Taxes are about power. What we are trying to build is a human economy where we and Beatrice work together to take that power away from the Bwana Kubwas of this world and build a movement that works for everyone. That's why we at Oxfam are joining you in your tax the rich struggles. Thank you.
As you can tell from the title of this talk, this isn't going to be one of those upbeat, optimistic stories. This is a story about it's time for us to get real with ourselves about what's going on in America. Americans are killing themselves at an alarming rate. Opioids are the story of the day, but the U.S. is really facing a triple set of epidemics of drugs, alcohol, and suicide. And these constitute 3 of the most serious public health crises of our century. Over 2 million Americans have died from these 3 causes over the past 20 years. Life expectancy in the U.S. has declined now almost 3 years in a row, due entirely to these 3 causes. And these life expectancy declines have been most pronounced among those without a 4-year college degree. The rapid rise of these epidemics over the past 3 years are a serious wake-up call to us that there's a big crisis in this country, a serious well-being crisis in this country. They're signals of major underlying problems facing too many Americans, problems related to pain, hopelessness, despair, disconnection, isolation, and declining opportunity. So how did we get into this mess? Well, I've been using the analogy of spark versus kindling to try to understand what's going on and to try to sort this out. And we all know the spark side of the story. We can probably repeat this to our friends and family members and people on the street. It's all about opioid overprescribing, right? Believe me, I'm as angry at Big Pharma as the next person. I'm angry at Purdue for their misleading claims about OxyContin being less addictive than other painkillers and for their aggressive marketing practices. I'm angry at physicians for selling their souls to Big Pharma and speaking at medical conferences about these new wonder drugs that would solve the country's pain problem. And I'm angry at state and federal government officials for deregulating pharmaceutical marketing practices and failing to regulate pain clinics, which paved the way for unscrupulous doctors to become legal drug dealers. But pharmaceutical pushers like Purdue couldn't have done their dirty work without America's increasingly unbalanced economy, an unbalanced opportunity landscape, and without the increasing hopelessness, isolation, disconnection, and marginalization of so many people in this country. Blaming the opioid crisis on big, bad pharma is satisfying, and for sure, they deserve their share of the blame. But it also lets the rest of our institutions off the hook. And it lets our policies off the hook for laying the foundation that made so many Americans vulnerable to these quick fix pills that promise to numb not only physical pain, but mental pain. Sure, opioid overprescribing may have been the spark, but a spark needs kindling in order to ignite. And it turns out that we can learn a lot about this kindling when we compare characteristics of places with high versus low overdose rates. It's no coincidence that pharmaceutical companies targeted and widespread opioid prescribing first emerged in the most economically disadvantaged and vulnerable places in the US, places with high rates of poverty and unemployment. Thanks to the effects of 30-plus years of economic restructuring and disinvestment in our institutions and our communities, many places in this country were primed to be vulnerable to opioids, drugs that numb both physical and mental pain, vulnerable to drugs that allow a temporary chemical vacation, a temporary escape from life's worries. So I want to understand, I've been trying to understand why the maps look like this. Why do some places have so much higher drug overdose rates than others? Why are some places red and purple? And why are some places blue? And when we combine overdose data with data from the census and other sources to identify why some places have higher drug overdose rates than others, three groups of factors really jump out: the economy, the family, and social infrastructure, or our community. So why these three? Well, these are the three arenas to which most of us attach all meaning in our lives. They're the reasons that we get out of bed in the morning. And if these things are missing or we've become disconnected from them, we are at risk of falling into some pretty troubling habits. So what connects the three of these is isolation and disconnection, dislocation from something that has meaning, a reason to get out of bed in the morning. What does this look like with actual data? Well, this shows average county drug mortality rates for counties in each quartile of economic distress, family dissolution, and the presence of religious establishments, a form of community social infrastructure. This is really quite simple. Counties with more economic distress, as measured with a variety of economic indicators, have higher drug overdose rates. And the difference between the most economically distressed counties and the least economically distressed counties over the past 10 years is 40,000 excess deaths in the most economically distressed places. The implication is that if those places with the highest levels of economic distress had had levels that were comparable to the lowest economically distressed places, we would have seen 40,000 fewer drug overdose deaths over the past 10 years. Family distress and the presence of religious establishments and other types of social infrastructure also matter, but those institutions have been unraveling. We put this all together and a very clear picture emerges that places characterized by more disconnection from institutions have higher drug mortality rates now. The signs were there. And guess what? These same factors also explain geographic differences in alcohol-related death and suicides. Our problem is bigger than opioids. It's bigger than drugs altogether. Opioids are a symptom and a symbol of much larger social and economic problems. Problems that are thanks to our rising levels of income inequality and a neoliberal policy regime that emphasizes the market and maximizing shareholder value over collective societal well-being. Portsmouth, Ohio is a classic example of these trends. Portsmouth was once known as a place that made things, with a thriving manufacturing base anchored by shoe, steel, brickyard, atomic energy, and soda factories. By the 1990s, those factories were long gone. Portsmouth was soon the pill mill capital of America, with more prescription opioids than any other place in the country. And in today, Portsmouth, the incomes are lower than the 1980s, unemployment rates and disability rates are high, and the drug crisis is rampant. Consider what's happened to real weekly earnings among people without a college degree. While earnings have surged among those with a bachelor's degree or more, they've remained stagnant among women with less than a college degree, and they've actually declined among men with less than a college degree since the early 1960s. In addition to that, Americans' chances for upward mobility, which is a key marker of the American dream, are in free fall. The probability that a child earns more than their parents at age 30 has declined in each successive birth cohort. Income inequality is at a historic high. The prime male labor force participation rate is at a historic low. Real wages haven't budged for the working class. Fewer jobs come with benefits like health insurance and paid leave. A large share of this country is truly struggling, and the chickens have come home to roost. And this despair and hopelessness have far-reaching consequences beyond our health. This shows how much Donald Trump overperformed in the 2016 election among counties with more despair. Across every measure of despair, Trump performed better in places with more of it. He did better in places with more economic distress, the worst health, the lowest educational attainment, and the most marital dissolution. The same types of places that were vulnerable to opioids, quick fix drugs that numb physical and mental pain, were also vulnerable to Trump's quick fix messages. So how do we bring hope back? The biggest problem with public health in the United States is that we invest more of our resources into tackling problems after they've arisen, rather than investing in preventing them to begin with. We have disinvested in the very institutions that help build strong societies: education, families, communities. These same big problems drove the crack epidemic of the 1980s and the meth epidemic of the 1990s and 2000s. And history tells us that once opioids have left the scene, we'll have another drug war to fight. Solutions to address these big problems are hard, but we can't keep kicking the can down the road and wait for the next population health crisis. Good economic policy is good public health policy. And good economic policy means strategies to reduce our really bad economic inequality problem. Revitalizing hope for a wide swath of the U.S. population, rather than just those living in fast-growing urban hubs, requires something akin to the Marshall Plan. Although the U.S. isn't currently fighting a war or recovering from the devastation of a war on our soil, the long-term effects of economic restructuring, globalization, the failures of trickle-down economics, and government disinvestment can be thought of as akin to the effects of war in many of the hardest-hit places. So how do we pay for this? Well, of course, we tax the rich. A new Marshall Plan might seem like a radical proposal, but the opioid crisis specifically and the U.S. declining life expectancy problem more generally are radical problems. We didn't get here overnight, and quick and easy incremental fixes aren't going to address or reverse this problem. A Marshall Plan for the 21st century holds promise not only for reversing the opioid crisis, but also for improving our population health and well-being more generally. Combating today's opioid epidemic and tomorrow's new drug epidemic involves us all reflecting on what kind of a society we want. It requires us to reject a society where a small number prosper on the backs of the majority. And until we're willing to invest the time, energy, and political will into addressing underlying causes of distress, despair, disconnection, not only are we not going to stop the opioid crisis, but we're going to remain vulnerable to future health problems. Thank you.